My second topic is on chemical peeling agents used for the acne. That is comparison of efficacy of 40% mandelic acid peel with 30% salicylic acid peel in mild to moderate acne vulgaris. So under the introduction, everybody knows these chemical peeling agents nowadays are very popular. Everybody knows about this. They are like little bit on the compared to the lasers, inexpensive technology, popular, safe method for the treatment of acne. Here, everybody knows about alpha hydroxy acid peel. Now, mandelic acid is newly added. Like previously, so many peeling agents were there, like glycolic lactic. Nowadays, is a mandelic acid, which is a alpha hydroxy acid peeling agent with anti-inflammatory, antibacterial properties with a fewer side effects. Though these are effective, they can still be associated with the adverse effects such as burning sensation, stinging sensation, post-inflammatory hyperpigmentation, like that. So here we are comparing the effectiveness of these two peeling agents in grade 1 and grade 2 acne, that's mild and moderate. So the primary objective of my study was the comparison of the efficacy of these two peeling agents, and both are in gel based in the South Indian patient suffering from mild to moderate acne vulgaris of the face. And secondary objective was the safety profile of the same. So materials methods. This study was a prospective, comparative, and was taken from the January 2020 to the December 2021, and the sample size was 100, which was divided into two groups, A and B, of 50 each. All the committee authorities and this institutional ethical committee, research committee have been taking the approval. Under the inclusion criteria, all the patients of age group 15 to 45 consenting were taken into the studies of grade 1 and grade 2 acne. But the exclusion under the exclusion criteria, pregnant women or lactating women's history of hypersensitivity of the either agents, patient with the grade 3 and grade 4 acne, patient with any hypertrophic scars or keloidal tendency, or with any active infections like herpes, any open wounds, or any cystic lesions, or the patient who have received isotretinoin in the last 6 months before the starting of the treatment are excluded. So these patients were randomized into the two groups, 50 of each. The group 1 received the 40% mandelic acid, and group 2 received 30% salicylic acid. Both are gel-based, and the treatment was done in every 2 weeks for the 5 sessions. The final follow-up was taken on the 12th week. These scoring were taken from the Michelson acne scoring system, and the clinical photographs were taken under the natural daylight to evaluate the efficacy of the therapy objectively. So this total acne scoring system was calculated like in grade 1 and grade 2, number of comedones into 0.5 plus number of papules into 1 plus number of the pustules into 2. The decrease of the percentage of this mass score from the baseline to the 12th week of the therapy was determined. So as we can see, more than 76%, if it's there, then it comes under the excellent improvement. Likewise, 51 to 75 was good, 26% to 50 was fair, and below 25 was the poor response. So under the observation and the results, as you can see, the mean age group in group A, that is mandelic acid, was 23.56. And in group 2, it was 22.78. So more or less similar only. And the mass score was at the baseline in group 1 was 20.16, which was reduced to 4.96 after 12 weeks of the therapy. Similarly, in group 2, you can see at the baseline, it was 22.80. Now it got reduced to 6.64. There was a very much significant difference in the mass scoring. Male to female ratio was 1:2.1. That is, female predominance was there. All the tests were performed at the 5% level of significance. Thus, an association was significant if the p-value was 0.05 or below. Post-peeling burning sensation, stinging sensation was normally seen and significantly seen in group 2, that is salicylic acid group. Mild side effects like were noted like burning sensation, erythema, dryness, pruritus in both the groups. Improvement grading in acne, all the patient in both the groups show the good and excellent result. That is more than 50% decrease in the mass scoring. Now we'll compare the percentage of excellent and good in both the group. So you can see 62% of group A people responded well, that is excellent. And similarly with the group 2, that is 44%. Now in the good improvement, you can see in 34% of the people in MA, that is mandelic acid group, and in salicylic acid group, it was 54%. The mean percentage improvement between group A and group 2 after this 12 weeks of the therapy. So you can see mean percentage improvement was 75.92 in group A, and it was 72.96 in group B. This is the graphical representation of the same. Here you can see this purple line, purple graph one is the excellent response. So in the both side you can see this. So good and excellent response were seen in the both groups. Under the conclusion and limitations, we conclude that both mandelic acid and salicylic acid are equally efficacious and well tolerated in the treatment of mild to moderate acne vulgaris. But there are two types actually, lotion-based and gel-based peels. So under the lotion-based, this much compliance will not be there because it will cause more burning sensation, stinging immediately after application of the peeling agent. So always go better with the gel-based peel, that is more give you the better compliance, and patient will not feel much of the sensation until somebody is hypersensitive to either of the agents. And in my study, I have taken 100 patients. So I haven't got any dropouts. So it was a good point for me. No dropouts were there in my study. And what the limitation was there, like after 12 weeks of the treatment, I have not called upon the patient for the recurrence to find out the recurrence rate. But till 12 weeks, it was nice. They have given a nice response. And also long-term prospective studies with a greater number of the participants are needed for the greater long days or more than 6 months is needed to substantiate our conclusions. These are my relevant references. In the pictures, you can see that is mandelic acid group. I have put this male patient and female also. So you can see the other than the acne vulgaris, you can see the PIH also got reduced in both groups. So patients were really happy for that because they came for the acne, but they got some other benefit also for the pigmentation. Also, the skin tightening or soothing effect was also there, which he or she was not aware before, but later on they were thanked for the same thing. And comparatively with the laser we compare, it's a little bit cheaper and availability is more than the lasers. So it's a good option. I'm mainly talking about the grade 1 and grade 2 acne. Thank you so much.